Shouldn't you, as a consumer concerned about the cost of health care, get a little bit educated about some facts? And the first thing is, when you buy something in the drugstore, the generic, even over the counter, many times is equal to the brand. Is that true?
Yes, that's true.
Okay, but there are good generics and there are bad generics. In fact, some generics are made by the brand under another name. That was a very common practice.
Yes.
Some of the prescription items have 4 or 5 names of 4 different prices, depending what you use it for, the same item.
Right.
I mean, there was something for the blood pressure, and there was something for your hair. The one for the hair was more money than the one was used for the other fact. So basically, it's what traffic will bear. And I think people should go to a doctor today when they get a medicine and ask them 2 questions. This drug I'm getting, is it on the market more than 2 years? Because if it's on the market less than 2 years, there's great concern we don't know the long-term side effects. Even at 2, it's kind of like...
Right, that's still not a long time.
So a great idea would be that if you get a prescription, I think it's done in Europe, if it's less than 2 years old, there's an indicator that this drug, we do not know. It can come back and haunt us. So the drugs that we're using for pain medicine that were on the market short period of times, there's no way a drug company can know a 10-year side effect if you use it all the time.
No, not until the end of 10 years.
I don't think any drug company sat down, let's hurt people and get lawsuits. They really, and a couple of them involved, we know Merck Sharp and Dohme has had a very, very strong ethical background. And their vaccines, like chickenpox, they spent 17 years, as far as I know, to get it on the market. They were that careful. Mm-hmm. And they had one vaccine that was a questionable contamination. They took it right off the market. They didn't take a chance.
Right.
So they're pretty ethical. It's unfortunate they got hit with probably someone who was not living up to their standards, and it's coming back to haunt them. But some drug companies don't even have those kind of standards. But most of the ones that I've dealt with as a former pharmacist, usually try to do the right thing, because the name can get destroyed with a mistake like this.
Absolutely.
But they do a lot of things that bother me. It's the cost.
Yeah.
Why is drugs so expensive? And that is the real reason healthcare is out of control.
Well, someone had once told me the drugs are so expensive because of the expensive research and development.
Yeah, but once the research is done, they know what that finite factor is. It's the marketing cost. They market, and they have salespeople coming and offering free lunches, and they do these pseudo-educational things where they get a doctor and they take a bunch of doctors to a restaurant and they talk.
And all of that costs money.
Cost a lot of money. To take 10 doctors to a restaurant, or 8, it costs them at least $50-$60 a doctor, if not 100. You got to have the salesperson there who's getting overtime. You can have a speaker getting, who knows, $1,500, $1,000, maybe $2,000 to speak. And he's not going to say anything bad about the drug. He's going to talk about it in a positive way, because he wants to do this again, because it might be how he makes his living.
But the expenses never stop. It's first research and development, then it's take the doctors out to dinner, then it's marketing, then it's advertising, it's product placement. And all of this, they have to price the drug to catch up for the years behind.
I think a couple things could change. The 18 years of a patent may be a little unrealistic today. I think the number of years in the patent could be extended a little bit. A minimum number of years when it's on the market, because the patent might be used for years they're just getting it tested. It can be tied up for 10 or 15 years. So I think they should have a longer period on the market. In exchange, a little bit of conscious price control. Okay, and I think if they want to educate the consumer, the best way is a reliable source is the doctor himself. A doctor, when he writes a prescription, is just as responsible in my eyes as the drug companies. So I think a doctor should sit down and do his due diligence. Obviously, he should be compensated to do all that work correctly. But if he does it correctly, he could save healthcare. Because if I have a choice, treating a strep throat with penicillin at $8, or amoxicillin at 14, or cephalexin, which used to be called Keflex, at 15, against a third generation cephalosporin that could be $200. The penicillin, there's no strep ever been resistant to penicillin. Sometimes it fails, it's because the patient didn't take it correctly, or there's something else living in the throat, maybe deactivating it, so you use something else that's a little bit more like cephalexin. But basically, if you get a choice between 2 or 3 treatment, and one is relatively inexpensive and safe and proven, and one that isn't, why are we using the unproven more costly? Does that make sense to you?
No, it doesn't make sense. It doesn't make sense.
And
the drug salesmen that come to the offices to see the doctors should bring the proper paperwork to leave with the doctor so he can educate himself on the drugs.
Well, they bring material they put together in very slick presentations. But I always ask the drug salesman, and what does it cost? And they amazingly don't know. They're not sure. How can they be selling me something and don't know what the wholesale cost of the drug is? There's a ointment for diaper rash in a kid. Now, there's a generic that's $10, and it doesn't work as well. So there's a new one, and I'm not going to mention the name, but when I found the price of it was $180 wholesale for a diaper rash. And the best way to treat diaper rash, take off the diapers, let it air dry for 10 minutes so there's no moisture on the skin, so no fungus can live in a dry area. You have a wet basement, you're going to get fungi. And if you let the basement dry out, the funguses go away. It's the same thing in the diaper area. You put a barrier cream, cheap stuff, $6, $7. It's expensive for barrier creams today. Desert
right.
and zinc oxide. And it works.
Yes.
I don't understand. I sometimes have no choice to use that $180 one because it got so out of control nothing is going to work. But if I did my job correctly and educated the mother to use good technique in changing diapers, I minimize my risk of getting a problem. Is that true?
This is true. But you must remember the drug salesman might be working on commission.
Oh, they are. Look, I don't begrudge anybody who works hard.
I understand.
But AOL
But
had a thing.
$180 for a diaper rash barrier?
Okay, AOL had a thing that the number one profession in this country wasn't neurosurgeons. It was certainly not pediatricians. It was drug reps. Now, most of the drug reps I've talked to aren't making that kind of money. I would imagine some veteran guy, regional guy, getting a piece of the profit. But obviously, you don't think the one that's coming up and training in 2 years is making that money. But still, some are making some big bucks. It could be they're doing cancer drugs. I don't know what they're doing to make the big money. It's very disturbing.
Yeah.